Hello, welcome to our group discussion. I am Jace Pickens Jones, and I live in the East Bay.
Hi, I'm Julie Din, and I live in Northern California as well, but in the Central Valley of California.
My name is Michaela Thompson, and I live in Sacramento, Roseville area.
Great. And we're actually going to answer the last question first to give some context for our answers to the other two questions. So the first one is, how does your background and cultural identity influence your theoretical perspective?
Yeah, well, I guess I'll dive right in. I'll go first. So obviously growing up in a really, really small, like rural conservative town, and then moving to a diverse place like Sacramento, I feel like it's made me really prioritize like multicultural therapy and like social justice oriented approaches, just like really trying to ensure that clients like racial, ethnic, like socioeconomic backgrounds are considered in their treatment, in the care that we give, right? And just trying to make sure that I'm being aware and being respectful and learning, when I do make mistakes and things like that.
Well, those are definitely great points, and I think something that I also aspire to do as well. For this question, I really looked at kind of my upbringing and my Vietnamese kind of background and culture and how community based we are. And so I feel like how I view my theoretical, or that's my theoretical perspective, is kind of looking more like for community based interventions. And then I kind of focus more on prioritizing the family and kind of seeing like the history of your family and how that has shaped or molded you. So that's kind of when we look at the theories, I kind of gravitate towards those, especially because I want to work with Asian Americans. It would make more sense to do so.
Great. Yeah. I think for me, so my dad was a prison warden for his part of his career, and actually he started out as like a counselor in a correctional facility, and had his MSW, and so I was used to him kind of talking about what that experience was like as a therapist, and then he kind of worked his way up in the administration part more. Um, and it was interesting to hear him talk about his experiences because we were living in very kind of white conservative areas of Pennsylvania, but the people he was working with were not. It was a lot of, people of color. And so a lot of his like cross-racial relationships were within the context of the prison system. And that definitely impacted kind of the way that he talked about people of color and that sort of thing. And so I think for me, seeing that and realizing that I don't want to be like that, to be honest, like wanting to be more culturally aware and look outside of kind of what is beneficial for me and recognizing that like as a white person, I carry a certain amount of privilege. And so wanting to acknowledge that and be working towards, being culturally aware and learning how to, help other people have their voice be heard and not always being, the first one to speak, even though I was on this call. Um, and, just figuring out like how to create a space where all people feel welcome, kind of no matter who they are or what their social location is. Um, so that's kind of where I'm coming from. Uh,
Yeah, I kind of wanted to, sorry, I just wanted
oh,
to
go ahead.
loop in just a little bit more with the theories specifically. A thought I had while, both of you were speaking, is, obviously personal experiences and family systems, they're really different, right? So like if a patient comes from a collectivist culture, they might resonate way more with like intergenerational family therapy, right? Or structural therapy, which is going to emphasize that role of family dynamics. Or like, conversely, if you're raised in an individualistic culture, right, you might gravitate a lot more towards CBT or like narrative therapy, which is going to focus on like that individual agency. So just trying to be mindful of that as we're going through this profession, and just trying to remain fluid, right, with our patients. And as because the average caseload is like 30 patients, so it's a lot of different people that you kind of have to keep that fluid persona, I guess, going, right? You got to try to like move with your patients and make sure that you're being as aware as possible. So that's all. I just kind of wanted to tie in some more theory specific talk.
No, I think that's great. And the other, like the next question talks about like how do you in envision change happening in therapy? And I think we were talking last week about the common factors in therapy and how like most of the change that we see happen with our patients doesn't matter necessarily what the theory is. It's like those common factors that help a patient or client connect with the therapist, like the therapeutic alliance and listening and being empathetic and that sort of thing. And so that makes me feel a little bit more comfortable because everybody keeps being like, what theory are you going to choose? Which one are you going to use? And I feel connected to a couple of the different ones. And so knowing that like as long as we have those common factors, it's okay to kind of adapt some of the other theories in a way that empowers our clients to be that agent of change for themselves.
I agree with that because I'm like thinking every individual is different. So it's not like we can just choose one and be like, okay, I'm going to apply that to every client that I have. Because I've kind of experienced that personally with my own therapy. I think after just hearing Michaela talking about it just now, I'm like, that's why I feel like I'm constantly venting in my current therapist now. I'm like, I don't know if I really connect because I just constantly feel like I'm venting because it really is so individualistic. And I feel like growing up, I'm not, I am more of a collectivism type of, in environment. So now it's clicking to me and I have an appointment tomorrow. I'm like, okay, that's why. So, yeah, it's just having all these different theories kind of in your back pocket so that everything could be fluid, right? Instead of being like forcing your clients to fit like a certain mold and be like, okay, this is how we're gonna apply it and you're gonna have to do it whether you like it or not, kind of thing. Yeah.
Absolutely.
Yeah, and kind of going back to what Jace was saying as well about, integrate. Actually, I think it was Julie. You just said that. I'm sorry. I can't remember which one of you just said it because you literally just said it. But was saying combining the multiple theories of different theories of change, right? So like addressing like you're going to be using multiples in your career, right? And maybe even with multiple people and maybe even in one session, right? So like for example, say you're addressing cognition and behavior, right? That's going to be CBT, right? While also exploring emotion and family dynamics, right? That's going to be EFT, structural family therapy, technique. So there's going to be multiple different things always kind of going on in this ball of therapy that we use.
Yeah.
One, I could only imagine as our career goes on that we're going to find different interests in in different things. And so I'm sure it's going to shift as time goes on too. So I'm interested to see like how, everything will kind of play out. Cool.
Yeah, and Michaela, you kind of just hit on to like what the last question is for us to talk about, which is like what does integration of theory mean and what would it look like in a theory of change? And I think we've kind of hit on that already in recognizing that like as we come into the room with our, at least for me, I kind of think, it's hard for us as therapists to totally set aside like who we are when we walk into the room. And so figuring out like how do we acknowledge that kind of context that we're coming from, even in our own processing, so that we aren't caught up in like countertransference and that sort of thing. and recognizing that like there might be patients that we resonate with more and there might be theories that we resonate with more, but they don't necessarily like mesh together. And so figuring out like how do we help this client figure out like the best course of action for them moving forward and having, I think, like the space for us to process with whether it's in supervision or whatever that looks like. And so it's about kind of balancing all of those things at once, and it's a lot to hold.
So I think you
Absolutely.
said perfectly. And I think
I know, right? Yeah.
we did touch on it. I think with the last question too of just, you know, being able to combine all these different frameworks in order to be fluid and flexible for your clients, to help create that change, right? I think, yeah, you said it perfectly, Jace.
I also think it's cool to have this conversation with y'all since we are in the same lab together. And so we're getting to practice using these different techniques together. And so thanks for
Yeah.
taking the time to chat. Does anybody have any other closing thoughts they want to share?
Well, I mean, I guess just kind of touching on the how do I envision change, obviously happening is just kind of like change begins when, you know, the therapist creates a safe, trusting environment, where clients can feel validated and understood. And it really requires a strong therapeutic alliance, and a good rapport. So just, um, making sure we have good awareness and insight, and giving them good places to process, right? I think ultimately, at the end of the day, is where we're going to see the most change.
Yeah.
Exactly. And then coming in with like a shared goal, right? Like ask being very clear with the client, like what do you want out of therapy and making sure that there is a common goal that they're both working towards, in order to see some change.
Yeah, exactly.
Absolutely.
Great. Well, thanks, guys.
Thank you.
Yeah, thanks for your time. It was a wonderful convo.